Our health partnership is a very large GP partnership of 37 practices serving 350,000 patients across Birmingham and latterly Shropshire. And in the last phase of the NHS long-term plan, we started to work with neighbours and colleagues who serve another 150,000 patients to serve 10 PCNs or primary care networks. Social prescribing is the first step of healthcare finally understanding that the majority of the determinants of health and well-being do not happen in a doctor-patient consultation, but happen as a consequence of our experience in life.
Quite often when patients come to see their GP, it's not necessarily a clinical need that they have. It may be a clinical need, but that's actually been brought on by something else that's going on in their life. It may be their lifestyle, it may be housing issues, it may be money problems. And those are the things that GPs just aren't equipped to help with.
The needs in our area was that we've got vulnerable people that were single parents, elderly people that really needed the support.
So we started working with OHP as social prescribing was becoming more prominent in terms of the NHS landscape, and primary care networks were due to be hosting and having social prescribers within PCNs. We started talking to OHP about our vision and our model for tackling inequalities, and I think we had a lot of shared values and principles about the role that social prescribing could play to support practices and the demand in primary care, but also about designing models that are very much about communities and citizens and connecting them to each other.
When resources are offered to health services, often the default setting is to internalise a new staff type, a new way of doing things, and that misses out on the opportunity of building relationships, partnerships across the community. And to me, social prescribing is very much a community-based service, and it has to build on and develop and make sustainable community assets and community services.
As a team, we've got a really broad skills mix, people from backgrounds of family support, mental health, working with vulnerable adults, people with complex lives. The actual team and the skills mix has been invaluable and has enabled us to support each other as COVID's hit.
So pre-COVID, I was supporting patients in their GP surgeries. So we were trying to find out what the patients were interested in, trying to engage them, communities, the harder to reach communities. We were also doing one-to-one interactions with patients to support them, whether it was housing, finances, or mental health needs.
As lockdown hit, we faced quite unprecedented levels of demand in terms of crisis support. We've got things like the food provision. Again, we were able to connect people to food parcels, to dignity packs, to support that they may not have been able to access otherwise. And I think GPs were really good at recognising the added value of that and connecting to us really quickly. When they were identifying patients that were vulnerable and in crisis, they were working with the social prescribers really quickly to offer that support and help.
We knew that things were going to have to change. We knew that things wouldn't be able to happen face to face, but we also had to look at the new needs of the patients. And in particular things like food parcels, which wouldn't have been on our radar pre-COVID.
It was amazing how quickly it all happened. You know, within days we had an emergency food distribution centre. Over the whole period of time, 482 tonnes of food were actually given out. Thousands of volunteers coming in across the city, providing support, delivering parcels, phoning people up, street after street, people signing up to support their neighbours, their neighbourhood.
There's lots of services out there for patients that we weren't aware of, patients aren't aware of, and it's just one phone call or one email to one person now and we can get everything that we need for our patients.
Clinically, I think as GPs it's helped us to be aware that not all patients need the medical help and identify a group of patients who have social problems, and these may be patients that are frequently attending our GP practices. And I think having the social prescribers helped us to be able to identify this group of patients and to be able to do something for them.
Many of our patients were having to self-isolate, that needed support with shopping. We had link workers going out befriending, being that voice at the end of the phone.
The Befriender service had a positive impact on people's lives in a number of areas. So some people have actually directly said to us how grateful they are for us just being on the phone to them and they wait for our phone call. There are people who have turned to their GP in a time where they need support and have been on the phone for a long time because they've had unprecedented amounts of calls to practices and they can't get through to them. And we've been there to be able to alleviate some of the pressure on the GPs and get the support they need. It could be around their health, it could be to do with the fact that they've they've got no one else to turn to and they're a bit worried about, you know, their own circumstance and where they're going to get support from.
That phone call is the bridge between sanity and losing your sanity. And that human touch, be it on the telephone, can have a big impact on somebody's life.
So today I'm going to see one of my patients called John, who I've been supporting during lockdown.
Me and Jenny, you used to talk on the phone once or twice a week. There was only a few people who was speaking to. You don't realise till you need somebody and there's really somebody there. The biggest benefit is to know there's somebody there who I can speak to and trust. This service has helped me in a big, good way really. And if I don't have them, I don't know who I'm going to turn to really.
I was in the house, I couldn't go out. The only place I could go was my garden. It was only me and my carer, and we needed somebody else. When you were calling me, I was looking forward to the call, just because it was somebody different and somebody that could take the pressure off. Your guardian angel that's come to help me.
You're here with me today on my walking group, and it's kind of a women's only walking group. It's really nice for everyone to get out, have a walk around the park, and it's really nice for me as a social prescriber to actually meet all the people I'm speaking to on the phone and actually be able to offer them some kind of support where we can walk around the park and we can have a little chat, because with coronavirus it's been really hard to find groups and different stuff people can go to if they're living alone.
The walking group has helped me quite a lot because it's socialising and getting out.
Gives me a point in the week where I have to go and do something. I come and do something healthy, get the fresh air.
It's just great to see people. That's what I like about it.
I've joined the walking group with Millie because I would like to lose a bit of weight, and I'm really enjoying the walks with her. It's been very nice getting out in the fresh air, and I hope Millie continues to do our walks because it's really good. Good for your body, good for your soul, and good for your mind.
COVID has been an appalling experience. We cannot underestimate how challenging it has been for some of our communities and for all of us. There will be loved ones we will never be able to say goodbye to. What it did show, though, was Birmingham people at their best, and it did show the importance of partnership, the importance of sticking together, working together, connecting together.
OHP and the Active Wellbeing Society have produced a unique system of social prescribers across Birmingham that work according to individual local areas' needs and priorities, but use each organisation's skill set to provide a really deep and broad offer to patients and their needs.
It's really good service for the patients. It's good for the doctors, good for the reception team to have someone that they can advise patients about. I think the future is a positive one for social prescribing.
So I think the future for us is going to be, where possible, where we can create that connection and we can have face-to-face contact. Of course we want to do that. But actually I think we've all learned that telephone support for the most isolated, for people who will still want to or need to be in their homes for the foreseeable future, that will still be there as well.
At these times of COVID, I would say to practices, the social prescribing service is there for you. Please use it. It's there to help your most vulnerable patients and citizens. It will help reduce some of the demand that you face day to day. And to patients and citizens, I would say, you can self-refer to it. You can access it for yourself, your family, your neighbours, your colleagues. So please do use it. It's very broad and wide-ranging, and it has a specific emphasis on COVID support. Social prescribing is there for all of us to support ourselves, our neighbours, colleagues and each other.